Ever wondered why your stomach acid doesn't backflow into your esophagus? Well, that's thanks to a muscle known as the lower esophageal sphincter, or LES for short. You can think of the LES as a gatekeeper, nestled right at the junction where your esophagus meets your stomach. This muscular ring's primary job, to keep the contents of your stomach, including potent gastric acids, from flowing back up into your esophagus. The LES typically maintains a high-pressure zone, acting like a one-way valve that opens to let food pass into the stomach and then closes tightly to prevent anything from moving back up. This valve-like function is crucial in preventing a condition known as gastroesophageal reflux, where stomach acid or bile irritates the lining of the esophagus. However, the LES isn't always perfect. Sometimes it can relax at the wrong times, allowing stomach acid to flow back into the esophagus. This occasional backflow is usually harmless and can happen to anyone. But when it occurs frequently, it could lead to a more serious condition known as Gastroesophageal Reflux Disease, or GERD. GERD is a chronic condition that occurs when the LES doesn't function properly and stomach acid frequently flows back into the esophagus. This backwash, or reflux, can irritate the lining of the esophagus over time and cause a host of symptoms. But we'll delve deeper into the specifics of GERD and its symptoms later on. For now, it's enough to know that the LES plays a pivotal role in our digestive process. It's not just a simple muscle, but a complex mechanism that works tirelessly to keep our digestive system running smoothly. And when it doesn't work as it should, it can lead to discomfort and potentially serious health issues. Understanding the anatomy and physiology of the LES is key to understanding its role in preventing reflux and the development of GERD. The LES is a muscular ring located at the junction between the esophagus and the stomach. Imagine it as a gatekeeper strategically positioned where your esophagus, the tube that carries food from your mouth, meets your stomach. This remarkable structure is about 3 to 4 centimeters long in adults. It's not just a simple ring of muscle, though. It's composed of smooth muscle fibers that are oriented in different directions, allowing it to contract and relax in a coordinated manner. This unique structure gives the LES its ability to maintain a high-pressure zone, which is vital in its role as a one-way valve. Moving on, let's talk about the gastroesophageal junction. This is the point where the esophagus and stomach meet. It's a bit of a crossroads in your digestive system, where the squamous epithelium of the esophagus transitions into the columnar epithelium of the stomach. This change in cell type is a clear indication that we've crossed from the esophagus into the stomach. The inner lining of the esophagus is designed to withstand the wear and tear of food passage, while the stomach lining is equipped to handle the harsh gastric acids that help break down food. The LES and gastroesophageal junction serve as the boundary between these two different environments, ensuring that each can function properly without interfering with the other. The LES and gastroesophageal junction are also surrounded by the diaphragmatic hiatus, an opening in the diaphragm. The diaphragm, a sheet of muscle that separates your chest and abdominal cavities, plays a vital role in breathing. But it also lends extra support to the LES, helping it maintain its pressure barrier against the backflow of gastric contents. So, as you can see, the LES is not just a simple muscle ring. It's a complex, multifaceted structure that works in harmony with other elements of your anatomy to perform its duty. This intricate structure plays a crucial role in keeping your digestive system functioning properly. And understanding its anatomy is the first step in appreciating how it contributes to our overall health and well-being. The LES isn't just a static structure, it's dynamic and constantly working to prevent reflux. So let's delve into the physiology of the lower esophageal sphincter, or LES, to understand how it works. The LES is a ring of smooth muscle fibers that encircles the bottom of the esophagus, where it meets the stomach. When you're not swallowing, this important muscle stays contracted, forming a tight seal that prevents stomach acid from flowing back into the esophagus, a process known as reflux. But the LES isn't always contracted. When you swallow, the LES relaxes, allowing food and drink to pass into your stomach. Once the swallowed material has passed through, the LES contracts again, resealing the esophagus. This normal function of the LES is critical in preventing gastroesophageal reflux disease, or GERD. However, there are occasions when the LES relaxes at inappropriate times, leading to transient LES relaxations. These relaxations allow stomach contents to flow back into the esophagus, causing the symptoms associated with GERD. Another contributing factor to GERD is a hiatal hernia. This condition occurs when a portion of the stomach pushes through the diaphragm and into the chest cavity, disrupting the function of the LES. The hernia can prevent the LES from fully closing, leaving a gap through which stomach acid can reflux into the esophagus. Impaired esophageal clearance can also play a role in GERD. Normally, any small amount of acid that does reflux into the esophagus is quickly cleared by peristalsis, the wave-like contractions of the esophagus that move food towards the stomach. But if this clearance mechanism is impaired, acid can remain in the esophagus for longer periods, causing damage and symptoms of GERD. So, in essence, the LES acts as a gatekeeper, protecting your esophagus from the harsh contents of the stomach. When functioning properly, the LES acts as a one-way valve, allowing food to pass into the stomach but preventing stomach contents from flowing back into the esophagus. However, when the lower esophageal sphincter, or LES, doesn't function properly, it can lead to gastroesophageal reflux disease, more commonly known as GERD. This is a condition where stomach acid frequently flows back into the tube connecting your mouth and stomach, causing a host of uncomfortable symptoms. The most common symptom of GERD is a burning sensation in the chest, known as heartburn. This typically happens after eating and might get worse at night. It's often mistaken for heart disease, so it's important to distinguish between the two. Regurgitation of sour liquid or food is another typical symptom. This is when you have a sour, acidic taste in your mouth, or the sensation of food re-entering your throat after you've swallowed it. Sometimes GERD can present with atypical symptoms. These might include a persistent cough, changes in voice such as hoarseness, and even dental erosions due to the acid reflux. It can also lead to difficulties or pain when swallowing, a condition known as dysphagia. Now, let's talk about the role of acid and non-acid reflux in GERD. Acid reflux happens when stomach acid backs up into your esophagus. This can cause the aforementioned heartburn and other symptoms. Non-acid reflux, on the other hand, involves other stomach contents coming back up into the esophagus. This can still cause symptoms, even though there's no acid present. It's important to note that occasional reflux is quite common and doesn't necessarily mean you have GERD, but if you experience reflux more than twice a week, it could be a sign of this disease. GERD can significantly affect a person's quality of life, but early detection and intervention can help manage its symptoms and prevent complications. Remember, if you're experiencing any of these symptoms, it's important to seek medical advice to ensure you receive the correct diagnosis and treatment. If left untreated, GERD can lead to serious complications. This isn't just a vague warning. It's a reality for many who ignore or fail to manage their gastroesophageal reflux disease. To illustrate, let's discuss Barrett's esophagus. This condition develops when the cells lining the esophagus change due to repeated exposure to stomach acid. Instead of the normal healthy cells, a different type of cell emerges, which is more resistant to acid but unfortunately also more prone to becoming cancerous. So while Barrett's esophagus itself isn't life-threatening, it significantly increases the risk of esophageal cancer, a highly lethal form of cancer. Next, we have esophagitis, an inflammation of the esophagus. This complication arises when stomach acid continually backs up into the esophagus, causing irritation and inflammation. If this inflammation becomes chronic, it can lead to difficulty swallowing, pain, and even bleeding. Then there are strictures. These are narrowings of the esophagus caused by scar tissue formation from long-term inflammation. Strictures can make swallowing difficult and may require medical intervention to widen the esophagus. While these complications sound daunting, it's crucial to remember that they are preventable. Early detection and intervention are key in managing GERD and preventing these complications. Regular checkups, especially if you're experiencing symptoms of GERD, can help catch any changes early, and if you've already been diagnosed with GERD, Adhering to your treatment plan and lifestyle modifications can greatly reduce your risk. It's also important to note that not everyone with GERD will develop these complications. The severity and frequency of acid reflux episodes, as well as individual factors like genetics and lifestyle, all play a role in determining who will develop complications and who won't. In essence, complications from GERD are not just possible, they're a reality for many, but they're also largely preventable with the right care and management. These complications are a testament to the importance of the LES and why any dysfunction should be addressed promptly. So if you're experiencing regular heartburn or other symptoms of GERD, don't ignore them. Seek help. Your esophagus will thank you. So how do doctors determine if someone has GERD? Well, there are several diagnostic methods that medical professionals use to detect this condition. Let's delve into a few of them. First among these is endoscopy. This procedure involves a doctor using a thin, flexible tube equipped with a light and camera to visually inspect the esophagus, stomach, and a portion of the small intestine. During this process, the doctor can see if there's any inflammation or damage to the esophagus, which are telltale signs of GERD. Sometimes they may even take a small tissue sample or biopsy for further examination. The next diagnostic tool is ambulatory acid, pH, probe tests. These tests measure the amount of acid in the patient's esophagus over a period of 24 hours. A small tube or a capsule, which contains a sensor that measures pH, is inserted through the nose into the esophagus. The sensor records the amount of acidity in the esophagus, helping to detect episodes of acid reflux and their duration. Another method is esophageal manometry. This test measures the rhythmic muscle contractions that occur in your esophagus when you swallow. It also measures the coordination and force exerted by the muscles of your esophagus. During this test, a thin, flexible tube is passed through your nose, down your esophagus, and into your stomach. These measurements give doctors valuable information about how well the lower esophageal sphincter is functioning and whether it's letting acid back into the esophagus. These diagnostic tools, along with a detailed patient history and physical examination, help doctors to accurately diagnose GERD. They provide critical insights into the function of the lower esophageal sphincter, the nature and severity of the reflux, and the degree of esophageal damage. Remember, early detection and diagnosis are crucial. The sooner GERD is diagnosed, the sooner treatment can begin, and the better the chances are of preventing complications. These diagnostic tools help doctors assess the function of the LES and the presence of GERD. Fortunately, there are several strategies that can be used to manage GERD. Let's start with lifestyle modifications. Adjusting your diet can be a powerful tool in managing GERD. It's generally recommended to avoid foods and drinks that can relax the lower esophageal sphincter, such as fatty foods, alcohol, chocolate, and caffeine. Equally, foods that can increase stomach acidity, like tomatoes and citrus fruits, may need to be limited. In addition to dietary changes, weight loss can significantly improve GERD symptoms. Excess weight, particularly around the abdomen, can put pressure on the stomach and cause the LES to relax, leading to reflux. Regular exercise and a balanced diet can help maintain a healthy weight and reduce the frequency of GERD symptoms. Now let's move on to pharmacological interventions. These are often necessary when lifestyle modifications alone aren't enough to manage GERD symptoms. The first line of treatment usually involves over-the-counter antacids, which can provide quick short-term relief by neutralizing stomach acid. However, for long-term management, medications that reduce acid production are often recommended. Proton pump inhibitors, or PPIs, are one such medication. They work by blocking an enzyme in the stomach lining that produces acid, thereby reducing the amount of acid that can reflux into the esophagus. Another class of drugs used to manage GERD are H2 blockers. These work by blocking histamine, a compound that stimulates acid production from binding to receptors in the stomach lining. This results in a decrease in acid production and, in turn, less acid reflux. It's crucial to remember that while these medications can help manage GERD symptoms, they should be used in conjunction with lifestyle changes for maximum effect. Also, it's important to consult with a healthcare provider before starting any new medication regimen. With the right approach, it's possible to manage GERD and maintain a high quality of life. The LES plays a vital role in our digestive system. This muscular ring at the junction of the esophagus and stomach serves as a one-way valve, preventing the backward flow of gastric contents. Its disruption can lead to gastroesophageal reflux disease, or GERD, a condition marked by symptoms such as heartburn, regurgitation, chest pain, and even atypical symptoms like chronic cough and dental erosions. Understanding the normal anatomy and physiology of the LES is crucial in comprehending the pathophysiology of GERD. It's also key to diagnosing and managing the condition, whether it's through endoscopy, pH monitoring, dietary modifications, weight loss, or medical interventions like proton pump inhibitors and H2 blockers. The complications of untreated GERD, such as Barrett's esophagus, esophagitis, and strictures, underscore the importance of early detection and intervention. So let's keep our knowledge and awareness about the LES and GERD sharp. Remember, early detection and intervention are key when it comes to preventing complications associated with GERD.